the team on the front lines in public health each and every day as we respond to this terrible epidemic. And A.J. Shaw, who's the director of the Delaware Emergency Management Agency, our point person in coordinating the response to COVID-19 pandemic, our interactions with our local law enforcement and healthcare providers, our hospitals, the frontline employees at those hospitals, the tremendous work that they're doing. We're going to go through a presentation, as we do in each of the press conferences, with an update on the current situation on the ground here in Delaware in terms of the number of positive cases, hospitalizations, deaths, and I think we have folks that have recovered. We have that number as well. I'll talk a little bit about some of the recent developments yesterday in the White House call with the Vice President and the nation's governors. We received guidance from CDC and NIH about reopening the economy across our country and individual states, which the President deferred to the governors to make those decisions as is appropriate and based on the situation on the ground in our states, as well as the health data in our states and the health of our communities, and we'll get to that. First, though, let's just go to the situation on the ground. These are yesterday's numbers. We're up over 2,000 now with 275 positive cases, and importantly, as we talk about the reentry criteria and gates recommended by CDC, these number of positive cases are continuing to increase, although, as we'll see in a minute, not increasing at the rate that we originally projected, which is the good news. The very bad news, of course, is we have additional deaths, bringing the total to 52. The vast majority, if not all of those deaths, are for our elderly senior Delawareans who had pre-existing health conditions, many of whom were residents of our nursing homes across our state. Positive news there, 378 recoveries, and so there are people who are coming down with COVID-19 and recovering and are returning home or recovering at home. And the hospitalization number there, both the positive case number and the hospitalization numbers are a little off, I think, yesterday, based on some counting issues that were there, and so we're looking at that. I will say that the hospitalization number over recent days has been a little bit lower than what's been predicted, and again, that's a good thing, but we don't know yet whether there's a trend there. And again, as we talk about criteria for reopening, the criteria includes all of those indicators, or positive cases and symptomatic patients being tested and hospitalizations going down for a 14-day period of time, which we'll talk about. So the breakdown across our counties of those positive cases, 1,000 plus cases here in upstate in Newcastle County. In Kent County, we have 352 cases, and in Sussex County, 698 positive cases. A little bit of a uptick, 22 unknown in terms of the county there of residents. Little bit of an uptick in Sussex County, and we'll talk a little bit about that as well. So here's the breakdown by age again. Pretty consistent, again, with the trends over the last several weeks. Again, the most vulnerable population, those populations are the demographic where we're seeing all those fatalities is in the 65-year-old and over. The vast majority of the cases, or the majority, I should say, simple majority, is in that 18 to 49-year-old demographic, and then very few cases for our children and teenagers. So again, here are the actions, the timeline of the response, and some of this will be relevant as we think back on our reaction and response to COVID-19 as we evaluate the timing of the shutdowns, the emergency orders, the shutdown of the bars, the gatherings of more than 50 people, of more than 10 people. Most recently, on April the 14th, the stricter measures in our long-term care facilities. One of the things that we've been saying time and time again, that the people most at risk are our senior citizens in those nursing home facilities, and so leaning into efforts to protect them is really, really important, and those measures that were required on that April 14th declaration are incredibly important as we move forward here, and will continue to be important even after we get to the point of moving into reentry. So this is a good illustration of kind of where we started from, and it's hard to see there the descriptions of the various lines, but the first line that stands out by itself was one of the earlier projections that we received based on kind of national data and some of the academic information that we got from FEMA. The line below that, that's a little red line, is a model that basically reflected what we were seeing on the ground here in our state. In each of those bars, you can see the total number of positive cases, with at the very top the breakdown in those positive cases with respect to individuals who needed to be hospitalized. In the model that we used from the beginning, based on kind of national experience, worst case scenario, on the high side at 20% was our original projection. We've reduced that based on our experience here in our state, where hospitalization rates have been closer to 12%, and we've reduced that assumption going forward to an increase or a percentage breakdown of 15%, so 5% less than our original projections. And what that points to, I think, is some success we're having in what everybody was calling flattening the curve. You can see how much flatter the curve is in this illustration compared to the original graph that we worked on and we received from one of the earlier graphs from FEMA. And the objective, of course, before we can get to reentry, is for that graph to flatten off and then start to come down for 14 days in a row. And I think the next slide takes us into that. No, I do want to, this slide is just a clarification that I want to make on something that I said yesterday, that based on the guidance that we received from CDC and the federal government and the timing of that, so 2 consecutive increments of 14-day reductions in our overall positive cases and a whole series of other criteria, that it would be unlikely, we hadn't made a decision yet, was what I said, it'd be unlikely that we would be able to finish the year. But schools will remain open until May 18th. We haven't changed that decision. Just wanted to clarify that. We don't have enough information to make that decision today. We have regular communications with the superintendents, and they're eager for a decision there, and I know parents across our state are as well. And again, we will use the guidance that we just received from CDC and NIH and the White House Task Force in making those decisions, because it specifically references the time frame for bringing schools or allowing schools to reopen in stage 2, as I recall. So we will encourage schools, as they are, to remain focused on remote learning and making sure our students are getting as much instruction as possible while the schools are actually not in physical session. So the next slide, we did, as I said, get this advice from CDC and NIH, and there are general principles that states need to follow in making their decisions. They are recommendations, and so there is some flexibility there. But clearly, what they want to see happen is that we have 14 days of declining patients that come in symptomatic, so-called presumed cases, and 14 days of positive cases, 14 days of declining hospitalizations, the ability to treat COVID-19 patients in hospitals without crisis care. And if you've followed our advice in each of these press conferences, that's been the thing that we've really focused on. And fortunately, with hospitalization rates now at closer to 12% than 20%, with the number of hospitalizations in the 210 to 220 range today. We'll see what that number gets to be. We're in pretty good shape there with respect to capacity. What we might see and what we're expect to see, I think, is maybe the need for additional hospital beds in the lower part of our state, and the available beds might actually be in the northern part of our state, so we're working on that as well. And probably the most important thing that needs to be in place before we can talk about reentry is to have a testing program for healthcare workers and more generally for the public, so that we can manage the economy and the health of the community at the same time safely. And that'll be a testing program, Dr. Rattay, that'll look quite a bit different, I think, certainly more extensive than the one we've been doing. On our White House call yesterday, that was the biggest question of all the governors for the White House task force, for Dr. Fauci, Dr. Birx, for the President and Vice President, is where's that testing capacity going to come from? We don't have it right now, and I know my colleagues in other states can say the same thing. So that has to happen first, just to get you to the starting line, and then there are a number of criteria. These are, those things that I just mentioned in some detail. So widespread testing, contact tracing. I didn't mention that before. So you test, you isolate and quarantine those individuals who test positive. You do contact tracing and tracking down people that might have come in contact with that person, and then further isolate and quarantine if you identify COVID-19 positive folks, with a focus on some of the communities, the minority populations that we've seen that have been hit hard by this pandemic, and again, adequate supply of PPE, protection for the healthcare workforce and first responders, and continuing social distancing, and we'll see that in a minute. There are a number of things that will continue in the next slide. So after we reach those objectives at the starting line, we'll be able to implement the phases, the three-step phases of reentry, which the White House Task Force recommends. And they will include continuing restrictions on our daily activity and the way business is conducted in our state. The new normal is going to be different than the normal, or the normal that we have become used to. And it will include these mitigation actions that will remain in effect, an emphasis on social distancing, requiring at least 6 feet apart as we have here on the stage, face coverings in public with advice around what that looks like, personal hygiene, hand washing, sanitizing stations, not touching your face, not shaking hands. It's going to be difficult for those of us political leaders who are facing election. I'm not sure how you campaign without shaking hands, but we'll figure that out. I guess bumping elbows. Limiting gatherings, first to 10 or fewer, which is the standard here in Delaware in phase 1, then 50 or more, 50 or fewer in stage 2, I think it is, and always in each of the stages protecting vulnerable populations and having them shelter in place. So I've been asked to put these numbers up, and first I want to, this is Child Abuse Prevention Month, so for all those social workers that work on this difficult challenge in our state, here are the help numbers for child mental health support, 1-800-969-HELP. Text DE to 741-741. Report child abuse or neglect to the hotline there, 1-800-292-9582, or report them online there at that website. And in an emergency, of course, always call 911. So with that as an introduction, I want to pass the microphone over to Dr. Rattay, and first thank her again. I can't thank her enough for the great work that she's doing. she is running at both ends and being dragged in several different directions at the same time by me, by members of the public, by our staff, by legislators, by public officials, and just doing a tremendous job under fire. So Dr. Rattay, thanks for your great work.
Thank you so much, Governor. So in public health, we do things in a data-driven way. And so if you look at this map right here, and probably many of you have been watching the map evolve over time, you will see that different pictures have presented. What this map shows us is downstate in the Georgetown area, but also Milford and Millsboro. We are seeing more and more signs of infection and an outbreak in that area. We also are keeping our eye on other areas of the state, like the Dover area, as well as Newcastle and Wilmington. And so we'll continue to look at these data and to drive our decision-making as we are looking to engage with and support communities where we are seeing more pictures of outbreaks. And this is going to be really important for us to, as the governor was talking about, really be able to reopen. We need to make sure that we're really focusing in on the communities where we are seeing more signs of infection. So when we think about community approaches, again, being data-driven, it involves testing and education in communities. And so we're focusing on three main overarching areas in our community approaches, including ensuring access to testing, as well as ensuring access to care, but also making sure that those who need quarantine or isolation are able to find safe places where they can social distance from others, like from their family members. And also, very importantly, is an education and community outreach component to this. And that means relying on community champions or community partners who are really part of the community and who are trusted by members of the community. So given the data and what our hospital partners and many partners are sharing with us as far as what we know is happening in Sussex County right now, which is significant increases in infection, we are working in those three focus areas in Sussex County. So in regards to testing, we are working with large employers in Sussex County, large essential employers, and this is really important not only for the protection of those essential workers themselves, but also to help protect the health and welfare of their families as well as others in the community. And I also want to mention how incredibly important it is and how heartening it is to work with our hospital partners. Our hospital partners, Nanticoke and BB and Bay Health, have been just tremendous to work with. In the last 48 hours, we have established testing plans to work with not only the large employers, but also working with community partners to ensure that we are increasing access to testing for individuals in the community. Quarantine and isolation is really important, and that's especially important when it's challenging for individuals to be able to isolate at home. So we are working with Director Shaw and DEMA to identify quarantine and isolation options for individuals in the community, but also for those who want to isolate at home. We want to make sure that they have what they need to be able to isolate at home. Additionally, we're working hard to ensure that individuals can be connected to medical resources in the community so that they're getting care early when they need it, as opposed to waiting till they are more ill and it's more challenging to help control their illness. Also, when we are working on quarantine and isolation for individuals, it's really important that we make sure that they have the food and other basic services like pharmaceuticals, etc., to be able to safely isolate. And then, as I mentioned, the community outreach component to this is really so important. It's those who are from the community, who know the community, who are trusted by the community, that can really lead the effort in helping to support individuals in the community. One of the things that we are doing in partnership with DEMA is creating care packages to really empower individuals to be able to protect themselves and their families. And these care packages include like cloth face coverings, like bandanas, as well as hand sanitizer and soap and household cleaner, as well as educational materials to help them, know how to keep themselves safe, but also how to connect to services like healthcare services if needed. Let me touch on testing. Our state lab has now tested 2,251 individuals, and 441 of those have been positive. And then the hospital testing collaborative that I have talked about quite a bit, we now have tested through all of our hospital partners across the state. 15,248 tests have been completed. And so, although, as the governor said, it is really important that we continue to work on expanding access to testing, we do want to make sure that people do keep in mind that if they have symptoms and they want to be tested, please call 211, where you will be guided to the testing access that's most appropriate for you. Now,
Thank you, Dr. Rattay. AJ.
Thank you, Governor. Got the slide here with the projections that the governor went over a little bit earlier. Just want to hit on a few points here. We do see that the protective actions that have been rolled out over the last month and a half are assisting us in really keeping the hospitalizations to a point where it's manageable. We know that's kind of was one of our key goals. The hospitals are managing at this time. We are concerned, as Dr. Rattay just spoke about, the population in Sussex County, where we've seen maybe some additional discharges from Newcastle hospitals, and now we're seeing that increase down there. So along with that outreach, we're working very closely with the hospitals across the state to really make sure the services and relationships are there to be able to move patients as needed to serve people inside a facility as much as possible. As well, kudos to our partners, both at the Department of Justice, Department of State, because a lot of what's helped this be successful is the outreach we have done to those essential businesses that are open now, to making sure they're educated and they understand the actions they have to take to be working safely in these new normals, as we're calling them. So we have provided a number of letters that provide guidance. We've also forcefully or handed over some cease and desist orders to merchants, and hopefully they've complied with the orders from public health. Lastly, personal protective equipment. We know that's a hot topic. We have feel we're in a comfortable position right now. If some orders come in over the next 7 to 10 days, we as in public health continues to push that equipment out as quickly as we get it, and we'll continue to do so as it comes in. Talking about PPE, kudos to the National Guard as well. They have individuals working in a number of projects across the state. They have several Guard members down at the Public Health Warehouse actually sorting the personal protective equipment as it comes in to get it ready to go out to either the hospitals, nursing homes, or our first responders across the state. They're assisting with numerous feeding missions, whether it's helping with the school lunch delivery of the school of some school districts, or next week they're going to be assisting the Delaware Food Bank in a few different pickup locations, where there'll be drive-through locations where people could get food packages if needed. And they will have also been, as we've talked about, whether it's Nemours or other healthcare systems providing some relief, whether it's pre-training or just assisting staff to prepare for the surge. So this weekend, as we go into preparing really the outreach that Dr. Atay talked about in some of these hot spots, we're coordinating with the hospitals multiple times a day across the state to make sure we're all on the same page and could shift resources around or patients around as much as needed. And then we'll continue to look at some of those outreachers. I think are going to be some of the initiatives that really help us help some of these communities that are having a little faster experience of cases. Something that Dr. Atay quickly went over, and I think we can't emphasize enough, and we've talked about since the beginning of this, is if somebody is showing symptoms of COVID and they're having the difficulty breathing, they're having the fever, they're having the shortness of breath or the coughs, seek medical attention. We saw too many people just this week that we heard from our partners down south that by the time they got to the hospital, they were already at a critical point. So we want to make sure we stress that if there is somebody that needs medical attention or medical needs, they are going to their medical care provider or the hospital before it gets too late. So with that, Governor, I'll turn it back over to you.
Yeah, thank you, Director Shaw, and thank both of you for your for your continued great work and attention to this situation. It seems to change every day. There's a different challenge, a different problem, and every Delawarean is really stepping up to the plate to address it. Again, thanks, as AJ said, to our Army and Air National Guard, just doing a great job. General Mike Berry's troops there. So we're in this together, as we've been saying from the beginning. Our message still is cases are increasing, so stay at home. Practice social distancing when you have to go out for an essential business, to the grocery store, to a medical appointment to pick up a prescription, to the convenience store, but try to stay home. And in particular, again, as I say, protect our senior citizens, our elderly parents and grandparents, friends and neighbors. Please reach out to them, and not literally reach out to them, but call them and make sure that they have their needs met. And when you're in public where it's hard, in places where it's hard, to practice appropriate social distancing of 6 feet. We're recommending that you wear a cloth mask. We've had some creative ones that we've seen here in this room today, and as you travel around as well. If you do all these things, we'll be able to get to the point, the starting line, if you will, for reentry, where positive cases in our state are starting to flatten out and then go down each day for 14 days, and then we'll be able to see some changes there. So with that, I'd open it up to questions. And Meredith, we said we would reserve the first question for you after somebody else tried to steal it from you.
Well, thank you. I appreciate that. In terms of PPE, how much is that the state is getting? How much is going to long-term care facilities, and what is the state's priority in terms of where PPE is being distributed, in terms of hospitals, long-term care centers throughout the community?
So I'll start this, and Dr. Tay might want to follow up. I will say there's not a priority, so nobody's not getting it in that pecking order. Our responders are getting it, the hospitals are getting it if they need it, and so are the care facilities as needed. Along with that is the education that goes along with making sure they are not, they're conserving it as much as possible while still lowering the risk to use it. So we continue to, purchase PPE. However, as we've heard before, we hear whenever you turn on the news, the supply chain is stressed. We need it, New York needs it, 49 other states need it, and along with a lot of the country. So I would say the priority is not necessarily nobody's getting it. It's just if there's education and making sure that we might not give them, if they ask for a number, we might say we're not going to give you enough for a month, we're going to give you enough for a week, and then we'll supply it next week, so we have a little bit more to go around and are able to respond to any blimps in the system.
Are any getting more? So are long-term care facilities getting more from the state than hospitals?
It is based on the size of the organization. So there's packages that are put together. So the larger the organization, the larger they're going to get. The hospitals right now, and Dr. Atay could check, correct me, I believe their requests have basically been for specific things that they can't get, not necessarily, hey, we need everything. The hospitals, for a good example is we partnered with Christiana Care about 2 weeks ago on a very big order that we flew in from out of the country. So the hospitals are relying on bits and pieces when their supplies get low. But again, everybody's still going out to the normal suppliers as well. Dr. Taylor?
And we have regular calls with the hospitals on that, and that's one of the questions. How are you doing with PPE? How are you doing with testing kits? And we track that basically on a biweekly basis.
Two times a week.
2 times a week, and they'll let us know we're short of masks, we're short of gowns, whatever the case may be.
Yeah, exactly. And so, we, the hospitals really have done a nice job stocking up. So long-term care really has been the priority for, who's been requesting the most and who we have been, pushing the most out to. We have a way that we calculate what the needs should be, and we have different, we call them push packs, but we push out to them PPE based on the number of residents that they have and how much, using conservation PPE approaches, how much they should need. But they have definitely been our priority for getting PPE out to them.
And we haven't heard much about the VA or any VA facilities. Have there been any cases or deaths associated with the hospitals or just long-term facilities there?
Yes, the VA is on our hospital call. They've only had a few positive cases.
2 right now.
I can look in my notes at the report at the meeting earlier, or the call earlier this week. They do very limited testing, so they've had a handful of cases. We can get you that number.
And in terms of numbers at the Air Force Base, is that something that would be included in Delaware numbers, or is that considered different since it's a military?
It would be included in our numbers.
Okay. And how many healthcare providers have been tested positive for COVID-19?
I don't have a specific number, but I can tell you, healthcare providers are at risk, and so we know that a number of healthcare providers throughout the state in a variety of different healthcare settings, whether it's hospitals, long-term care, primary care, have been positive for COVID-19.
Is that information the state would make public? I know other states have, just at large.
We're not tracking the specific numbers, so it's not so much that we're not making it public, but what we do is when we know of healthcare providers, when we do our interviews, we identify if they have been exposed, or if others in the healthcare setting have been exposed, because that's potentially a high-risk setting, and then we will follow up as appropriately. So, for example, we would follow up with the hospital if a positive case may have exposed others in the hospital.
And is there...
If I could just add, just to take us to what a lot of people are going to be talking about, is these criteria for reopening. Protecting these workers and employees is a baseline requirement.
And is there a concern that there's a discrepancy in the data regarding cases and deaths at these long-term care facilities? I use Milford Center as an example. They themselves reported 12 deaths, where I believe the state, as of yesterday, reported 8. Can you speak to that discrepancy at all?
Yeah, I can speak to that discrepancy. And I'm not sure I fully understand why Genesis nationally is using they're using their own definitions. They're not using CDC definition, case definition for COVID. They are using a long list of 17 symptoms to consider somebody a presumptive positive if they have one of those symptoms. Their numbers they do not match ours at all. Now, I will tell you, we have a team out there today, and we are testing their presumptive positives because we do want a more accurate count of what is going on there. Our team is also, of course, this is the second time we've been in there in the last few weeks, but we're also making sure that they are completely on top of infection prevention and control protocols.
Is that something that you're seeing at other long-term care facilities too, in terms of using different criteria, or is Genesis just the first one that comes to mind?
That is the only one that I am aware of that's using that different definition.
Okay. I can keep going. But...
Thank you, Meredith. Don't let the guy with the glasses up there. He's got the tough questions.
Jake Owens, Delaware Business Times. We've been hearing a little bit more in recent days, recent weeks, Governor, about potential revenue impacts on the state. I'm interested what conversations you've been having with legislative leaders and where you find their role to be, since the legislature has been pretty quiet over the last couple of weeks.
Yeah, so we have regular conference calls with leadership and regular individual calls with individual members of the General Assembly. Mostly they're calling with complaints, concerns, questions that they're getting from their constituents. And I know everybody up here has been taking those calls. We've been doing Facebook Live sessions with them, Q&As. There's a tremendous need for information out there. We have a staff person whose sole purpose is to field the calls from legislators. I spent several hours this week talking about the model or the projections that we use, which are really pretty basic and simple, and we've been presenting here at these press conferences for the last couple of weeks, and we presented it today. It's not anything mysterious. And so it's mostly that. We would like to at some point get to the point of bringing back at least the joint finance committees. I know there's been some conversation about that between Director Jackson at OMB and leaders. We don't have an agreement there about that, but we need to ultimately have a budget. By the end of the year, there's quite a bit of uncertainty, as you could imagine, and as you might take from the wide range in my estimate about lost revenue. Just about that, what's the revenue estimate going to be to base our budget spending on? It's going to be significantly less, that maybe as much as $1 billion, certainly $500 million, less than the projection that we had for the budget I presented in January.
And just kind of piggybacking on that a little bit, has there been any discussion about potential continuing resolution to extend past the normal June 30th deadline, considering that some of our piggyback personal income taxes are now being pushed into July?
Yeah, I've heard some discussion about that. I'm not supportive of that kind of an approach. I spent 6 years in Congress. We actually never had a budget when I was there. We had continuing resolutions all the way through, and I don't think that's a good way to do your fiscal management.
The next question comes from Tom Lehman at WBOC. He says some lawmakers believe the legislature should be back in session and that you may have overstepped some boundaries or are going far in some areas and making decisions lawmakers should be involved in. What is your response to them, Governor Carney?
Well, it's not for me to determine whether the legislature, it's a separate branch of the government, whether they ought to be in session or not. I don't believe that I've overstepped my grounds, certainly by issuing a state of emergency. We in the executive branch have a power and authorities that otherwise we would not be able to do without action by the General Assembly and other entities. It's really the only way, I think, effective way to manage a crisis situation like this. It's just we make decisions on a minute-by-minute, hour-to-hour basis, and we're not able to have committee meetings and public meetings and all of that. We do our best to share information with legislative leaders, to take their input with respect to decisions that are being made, to take the input of the business community, of nonprofit community. I was on the line with them yesterday, with ordinary citizens in our town hall meetings, and constant communication with the White House, our federal delegation, and we have considerable input into the decisions that we make, but ultimately in a situation like this, these decisions have to be made by the governor and by the executive team, the emergency management team, and that's really the only way to address and respond to a pandemic like this. This is uncharted territory, and so it's easy to, challenge and ask questions about decisions that are made or anticipating things that are coming. I certainly understand that, but the only way really to make thoughtful decisions expeditiously, it's really a timing thing, and to do it with everybody's interest in mind, I think, is with the state of emergency system that we're working under.
Lauren at NBC 10 asks, do you have enough tests to be able to determine whether it's safe to reopen or not?
No. I don't mean to be flip. Not only do we not have enough tests, nor does any governor in the United States of America have enough tests. But and I don't know that anybody has, a firm handle on what that testing regime would look like. We got a recommendation from CDC earlier this week or last week. Dr. Rattay, it was based, I think, on the testing program that was developed for the AIDS epidemic, I think. And so, again, this is uncharted territory. We know that we need to go to an intense testing, isolation, social contacting, or contact tracking system, and we're developing that plan. Dr. Rattay, you want to add anything to that, or?
Yeah, I mean, I completely agree. Even when we speak with our hospital partners who all have developed the capacity to do testing in-house, they still can't get the reagents that they need to be able to do testing. And so we are eager for that to change, but we are not where we need to be yet.
Two thoughts piggybacking on that then. We've heard a lot about the rapid test, that it is blood-based rather than the swab-based. But we've also heard the manufacturers kind of say that there is a risk of false negative on that. So let's say presumptively we can get enough rapid response tests to start doing some of these phase 1 ideas. Is that a test that we really are comfortable relying upon to reopen society?
Yes, so there's two main tests. One is a diagnostic test or a PCR test, and then there's the antibody test, which can be used for diagnosis, but in many ways is better to see if you've had the infection. And so both have a place, and we are using both tests in our state, but it is really important to recognize, as you said, they both have limitations. The PCR test is, it uses the swab. There are more rapid forms of it available now, which our hospitals have, and we have, for example, in the Department of Correction and elsewhere. But that won't tell you if let's say you had the infection 3 weeks ago, that may not tell you that. The antibody test, we do see a lot of false negatives, or presumably, we're not sure. We've been validating, or we have validated a test here that we like, and we have seen some false negatives, but that tends to be if we don't get enough blood. So, we're figuring out how to avoid the false negatives, but we're very cautious and conscientious of the fact that false negatives can occur, and so we treat a negative accordingly.
On that same idea, assuming we don't have enough tests that we want into May or June or beyond, is there any scenario where enhanced social distancing guidelines might allow us to reopen, or if we don't have the tests, we're not reopening?
Well, let's be clear, the framework that was presented to us, which we're still, evaluating and working through, were recommendations. They weren't requirements. I thought they were good guidance, just as a framework in terms of phasing, 3 phases. In order to get into phase 1, you have to meet certain requirements. I was always wondering what does that look like? We talk about you got to have a healthy community before you can have a healthy economy, and they're connected. You can't have a healthy economy without a healthy community. So we have some guidance there. And so this situation, if you look at our graph, it's much flatter than the graphs that you see in other states, and that could be a function of the metrics in the presentation. But it looks pretty flat in terms of the numbers. So what does that mean in terms of peaking and getting over on the other side of the peak where you start to see the declines, and what are the things you really have to focus on? Every business sector, I think, is a little bit different because of their ability to accomplish social distancing within their facilities. And so that'll be part of it, I think, working with sectors to determine operating procedures under which they can be in business safely.
Next question's from Tom Lehman at WBOC. He says, what do you say to people and business owners who are pushing for a more aggressive timeline on reopening the state, or at the very least, some businesses and industries? Some have even planned a protest of the extended closure of the state, similar to what has been seen in other areas.
Yeah, I would start by saying protests aren't helpful at this point in time when we're trying to make very difficult decisions in uncharted waters. And I understand the sense of urgency behind that. I hear the anguish in the voices of people who want to go back to work, business owners who are looking at losing their businesses that they spent generations. Many of them are family businesses, and it hurts my heart. It also hurts my heart with each one of those Delawareans who've passed away as a result of the COVID-19 pandemic there. And so they're very difficult choices. As I think I said earlier in the week, the choices ahead of us, I think, are going to be harder than the choices behind us, because it's you don't want to open a day too soon and be at risk of a rebound and have to close things that you've opened again. That just really is a bad thing. You don't want to do something that's going to put people at risk, and you need to accomplish both. You need to accomplish a healthy community and a healthy business sector, and that's kind of what I would say, and what I do say to constituents and workers and businesses alike. We need to protect you, and we need to give you an opportunity to come back online. I've used the analogy of a flick switch and a dimmer switch. The three-step process that's been recommended by the federal government looks like a dimmer switch. But one of the things that everybody needs to be clear on, and Dr. Rattay can underscore this, is that it is going to be a new normal. It's going to be different. It's going to be, even you look through all the recommendation, it includes social distancing, limitation on large gatherings, appropriate hygiene. As long as that virus is out there without a vaccine or effective treatment, we're going to have to live our lives a little bit differently. The idea is to live it safely, with more people going back to work, with our economy, with the lights turned on more in our economy than before, and gradually getting up to as much a full force economy as we can.
With the employers that you're working with on testing, who are those employers?
When you say, I'm not sure with respect
to the testing that you're working with downstate.
Oh, downstate.
Yeah.
Specifically, we intend to work with the poultry processing plants and those companies. I have a conference call this afternoon with the leaders of those groups. Public Health has already been down to a number of their facilities to see the protective measures that they're taking, to recommend additional ones, which they did undertake, and to try to test more broadly in that community.
Governor Carney, lots of questions about schools. Johnny Braxton at 6ABC asks, what are school districts telling you about how their homeschooling is going? I know it's a different format for a lot of folks.
Yeah, so some really positive stories and then some challenges, right? And the challenges tend to center around internet access and broadband access, and the ability to get material back and forth from teachers to students. I think I hear challenges anecdotally about kind of attention spans and whether students are actually paying attention, if that makes sense. I can think of myself as a 12-year-old kid. If my mom wasn't around, would I really be doing my work there, or would I be trying to do something else? I think we need to be somewhat realistic about that, and that's why I consistently say, and I hear really good things. I have been walking up at Mount Pleasant High School track there, and several days I saw Brandywine School District handing out notepads or computers to their students so that they had that kind of access to instructional material. So it's a little bit mixed. It's obviously more difficult for children that aren't as connected as others, and that's concerning. It's also concerning that so many students are missing this amount of instructional time, and that's why I think it's important to lean into it.
A follow-up question from Johnny Braxton about the schools. If they do remain closed, what will it mean for student readiness to advance to their next grade level?
Yeah, that's a really good question, and I'm probably not the right person to answer it. My Secretary of Education, Dr. Bunting, and her team, and the superintendents across our state are going to need to think about what kind of activities, what kind of instructional programs they can activate over the summer. What are they going to do at the beginning of next year with respect to the need for remediation on some of their math curriculum that they didn't get to, or they're going to have to help the children and the students catch up in particular areas? I would imagine so. We're going to be asking them, for their plans to do that. Obviously, there are standards that are in place that the students need to know and be able to do with respect to English language arts, social studies, science, math, and so that'll be the focus. And I think part of the rationale of those who would like me to say the schools are going to be closed for the rest of the year is so that they can start planning and thinking about that. And I understand that, and that's a reasonable consideration.
Doug Brainy at Delaware Business Now says, yesterday the maximum sales figure was raised for restaurants under the state's HELP program from $2.5 million to $15 million, while other eligible businesses are still limited at $2.5 million. Any reason for this difference, since restaurants are still able to get some money from takeout service, while other businesses are shut down and have zero sales?
Yeah, if I understand the question correctly, the requirements or the limits to the original HELP program was limited to revenues of the amounts that you mentioned. And what the Division of Small Business within the Department of State, Damian DiStefano and his team were finding was there were a lot of small businesses, clearly small businesses and restaurants in particular, that had revenue in excess of that cutoff and therefore were falling through the cracks. And so my advice to them and Secretary Bullock's advice was, let's see if we can plug that hole and also do it in concert with the federal small business programs, which have a forgivable loan, which is a better deal than a loan you have to pay back, to just fill holes that exist. And they continue to look at that, and this adjustment is, if I understand it correctly, is part of a part of that. I know the federal program was oversubscribed in like a week or two, and that's what the debate is going on in the Congress right now, and with the president about what they want to refill that account, if you will, that program, and that would be a good thing. There are other programs that folks want to be added to that, including some priorities that the nation's governors have. But it was really an effort to try to help as many businesses as possible. With respect to the federal program, I've seen the numbers. There's a huge number of Delaware businesses, I want to say between 1,500 and 2,000, and a very large total dollar number of assistance.
Kind of piggybacking on that, specifically looking at the Paycheck Protection Program, that PPP that you're discussing, the early results, the 3/4 or so results from SBA show that Delaware ranks last out of all 50 states in terms of total loans approved as well as aggregate value of those loans, even behind some states with 40% less population like Wyoming. So I'm wondering if you've had any conversations with the congressional delegation about if there is more funding allocated later this month, whether there's something that Delawareans can do to make sure we get a bigger chunk of that pie.
Yeah, no, I haven't heard that. I heard something about that in the media last night or yesterday with respect to another state, but I have not heard that. It could be in the structure of the program. For instance, in the larger stimulus, each small state was given a minimum of $1.25 billion, I think was the number, some of which had to go to the larger local governments. And it could be in the structure of that, I don't know. What I do know is there are Delaware businesses that would like to get access to that program, and I know our delegation is interested in making sure that they can get access to it.
Maybe just rephrasing the question that
Sure.
Doug had then, in terms of, there may be a gap of a week or two or more where Congress doesn't reallocate more funds for PPP, and since that's one of the hallmark programs to protect small businesses, I'm wondering if there's any aptitude here at the state to increase the eligibility factors for help to maybe some other small businesses that aren't hospitality related to maybe get in on some of those funds, because it sounds like the participation's been rising slowly in that program.
Yeah, so I'd love to be able to do that. I'll have to talk to Davey and Secretary Bullock. I know that their original focus was on particularly those businesses that we basically said, you got to close.
Right.
By government action, if you will. So we felt kind of very responsible for a public good, not for no reason, right? So protect everybody's health and safety. So that was the focus. Yeah, I'd be interested in expanding and helping in any way that we can, recognizing that unlike the federal government, which can borrow money until people stop buying our treasury bills, we cannot.
Our final question comes from the Delaware Public Media. They ask, are there any areas or communities in Delaware where you're concerned about an undercount of cases due to lagging information or access to testing, et cetera?
I'll just say one thing, and I know Dr. Rattay has some thoughts about that, is that I'm always concerned about communities, underrepresented communities, and communities that we know start with certain health deficits, health disparities in terms of a greater burden of heart disease, hypertension, diabetes, all of those things, which put anyone at greater risk to a virus like this, are concerning, as well as communities that have, relative to other communities, limited access in terms of transportation and the like. And so that's one of the things that we're interested in looking at, particularly as we get all of the race and ethnic data that presently we don't have, and we're optimistic that we can get more of that and take a look at that. We've been talking this morning, and one of our highest priorities right now is our attention on what seems to be an increase in cases in a particular community in Sussex County, namely the Hispanic community. And so, yes, those are areas of concern. Anytime we would see an increased number, an outbreak of sorts. That's why our focus has been from the beginning on nursing homes, that we have more information and more testing in those communities and populations.
Yeah, I'm not sure I have a lot to add to that. I mean, we worry a lot about communities that have more access issues, that have more transportation issues, that may not have telephone service. The testing program that we have right now, I'm really grateful to the hospitals that they have set up testing sites throughout the state, but they're not everywhere in the state. I mean, they're not in every single census tract in the state right now. And additionally, we know that increasing access geographically, but also making sure that we're addressing any barriers to testing are going to be important as we move forward.
So as we close up, I want to thank the media again for participating today, for coming and covering this press conference, and for getting the word out, our message out, the information out to the public. This is a kind of unprecedented situation in the history of our state, a situation that none of us have seen in our lifetimes. Difficult decisions involved federal, state, local governments working together with their partners in the hospital, medical community, first responders, community service, helpers, churches, faith community across the board. And we're all in this together, as the message I've been saying. Our heart aches for each one of those 50-plus Delawareans who have passed away. Our hearts go out to family members who haven't been able to pay their last respects in an appropriate way at the funerals that we're used to. on just the message that we'll get to the flattening out of this and the peak faster, as long as people observe social distancing, practicing appropriate hygiene, staying safe in public, staying at home. But when you have to go out to the grocery store, to the convenience store, or to the pharmacy, to make sure that you have a cloth mask on, that you're conscious of keeping your distance from others in the community as you go out and about. And hopefully we'll get to that starting line as soon as possible, where we can start the countdown of 14 days of declining positive cases, of declining patients with flu-like symptoms coming in, getting to the point where we have a testing regime that's appropriate to reopening the government to keep everybody safe, and that everybody works with us as we move to that ultimate goal, where we can start turning the lights back on in Delaware gradually with its economy. And if we work together and follow the guidance, we're going to get there, and we'll get there sooner or later if we all stick together. So thank you very much, and have a great weekend.